SUI as far as modern management is concerned. I also welcome three learned chairpersons who are going to chair that respective session. Dr. Kiran Sinha from Kanpur, Dr. Chitra Setia from Noida, she will join little late. Dr. Rakhi Singh from Noida, even in spite of ill health, Rakhi has joined. It shows her commitment to academic activity. Welcome, Rakhi. I also welcome all the learned panelists who are going to bombard question to me. And being a moderator, I am going to answer all the question and to try to solve all the queries related to POXO Acts and its relevance in our OBGYN practice. So I welcome all the learned panelists, Dr. Ritu Jain from Ghaziabad, Dr. Manisha Jain from Ghaziabad, Dr. Sadhna Jaiswal from Greater Noida, Dr. Samta Gupta from Greater Noida, Dr. Kalpana Dixit from Kanpur, Dr. Reshma Nigam from Kanpur, Dr. Salini Agarwal from Khuramakanpur, Dr. Ritu Mittal Arya from Khuramakanpur, Dr. Aradhna Singh Bundela from Noida, Dr. Sweta Mathur from Noida, Dr. Manisha Saxena from Noida, Dr. Archana Sharma from Ghaziabad, Dr. Aarti Tandon from Noida, Dr. Rekha Gupta from Kanpur, Dr. Vani Puri from Ghaziabad, and Dr. Vandana Jain from Greater Noida. I also welcome Dr. Asha Jain, who is convener in this series since long from Raipur. And I welcome two learned coordinator, Dr. Rekha Rajendra Kumar from Bengaluru. She is in this series since long. And Dr. Kanchan Sharma, she is coordinator for today's webinar. And I would like to put in record my all deep sense of gratitude to Dr. Kanchan Sharma. She has helped me a lot for this very webinar. Of course, Kanchan is always with me in any of my academic activity. So welcome, Kanchan. And I welcome all the president and secretary of respective societies who have joined this webinar and all the delegates who have joined this webinar. In era of COVID, when physical meetings were not possible, we started this series with 4 friends. And now I am happy to announce that this family has become more than 7,000 plus members as far as Happy Learning Masterclass web series is concerned. And always we go with very focused topic for discussion and to meet our Foxian friends on virtual ground and to say hello, to discuss topics and to solve our question or query related to that very subject. So with this remark, I would like to welcome all the delegates and all the learned faculty who have joined this webinar, and happy birth anniversary of our great leader, Netaji Subhash Chandra Bose, who had given us a slogan, "Chalo Delhi, tum mujhe khun do, main tumhe azadi dunga." So we remember that great soul for today. And with all this due regards, respect to that departed soul, I welcome you all again. Thank you very much.
Thank you, sir. Now I would like to introduce convener Dr. Kanchan Sharma, ma'am. She is Secretary, Obstetric Gynec Society of Kanpur 21 to 23 and the coordinator of this program. Ma'am, I'll stop sharing and I request you to say a few words as you've helped sir in getting this program together.
Thank you very much for your wonderful words. Good evening, all the respected faculty and dignitaries. With a special respect to our chief guest, my mentor, respected teacher and motherly figure, Professor Dr. Meera Agnihotri Madam, my regards to you. My full appreciation, support and congratulations to Dr. M.C. Patel sir, who in spite of being so senior is most humble, very knowledgeable, very sweet and always helping. Sir, congratulations for 177th episode of Masterclass. Each episode is full of knowledge spreading and sharing. Today's episode contains very important topic of SUI, modern management of modern management. The speaker is no other than our own Dr. Kiran Pandey Madam, a chairperson of Medical Education Committee, very learned and knowledgeable person. I am sure that reverse panel will be very interesting. Dr. MC Patel sir is one person who really helped me a lot in my journey towards National Chairperson of NCD Committee, POXI. He has taught us that how to succeed in your mission, you must have full-heartedly devotion to your goal. You must have lot of determination, dedication, self-discipline, and effort. Thanks a lot, sir, and best wishes.
Thank you.
Regards.
Thank you, Kanchan.
Thank you, sir.
Thank you, Kanchan ma'am. Now, sir, with due permission, I'll introduce the
Yes.
chief guest.
Yes, yes, please.
There is no need for introduction, I believe. Don't waste your time.
Ma'am, just thoda sa. So we have respected Dr. Meera Agnihotri ma'am with us, who's the professor and head Department of Obstetrics and Gynae, GSVM Medical College, Kanpur, and chairman of the Ethics and Research State Medical College, president WWW Foundation. Ma'am, you'll have to tell us what that is. And successfully, she has led collaborative group of 13 organizations supporting the FOGSI position statement to Ministry of Health, Government of India for COVID vaccination to lactating and pregnant. I think that is the biggest thing that could have been done for our women. So welcome, ma'am. We are eager to hear words of blessings from you.
Thank you very much, Asha. At the outset, I extend my heartfelt gratitude to Dr. Patel, who is a very good friend of mine, I'll say. And Dr. Patel is associated with me in the journey of academics for a pretty long time. And we are really addicted to his mesmerizing lectures in Kanpur, anywhere else, wherever he go, we have chaired, co-chaired, and being, you see, judges in many sessions, many workshops. So I know him in and out. I know he's a very hardworking person. And will you believe it that apart from our academic activities, I very often call and talk to him, and he talks to me on non-academic activities also, with the what should we do, what is our role in paying back to the government and this and that. And I really enjoy his gesture of talking to me, and I learned a lot from youngers also. So Dr. MC Patel, I really congratulate you for your endeavor, for whatever you are. You are a highly academic person. We have enjoyed, and we all are really mesmerized by the lectures, especially for the medico-legal activities which you really give. We keep watching without blinking, and at the end, we just keep appreciating. So I believe both the chairpersons from the Kanpur, Dr. Kiran Pandey, the Medical Education Committee, and Kanchan for NCD Committee, they will agree with me that when we put the name of Dr. MC Patel, Kanpur people, and wherever we put it, we really enjoy and wait for how he starts and how he finishes the lecture. So, Dr. Patel, we are all with you. Apart from any academic activities, he is just like an extended family to me.
Yes.
I really appreciate, Kanchan, the way you have coordinated, and you keep on this work. You know that these are one of my, you see, best wishes for my youngers. I never call students, for my youngers, that they must carry this message. The hard work is the only thing by which you can climb a ladder. Kiran will be talking on such an important subject. She was head of the Department of Obstetrics and Gynecology, GSVM Medical College, Kanpur. We have worked together for a very, very long time. And in spite of her status today, I never understand that what should I do. But I keep on ordering and I keep on getting the returns back. I really enjoy it. And after telling, ye karna hai, wo karna hai, uske baad Then I realized that I am talking to a chairperson of a national committee. So that is what I enjoy it. My friend, Dr. Sharma and Dr. Two Sharmas from Ghaziabad, Archana, both Archanas. One Archana is from Kanpur and one Archana from Ghaziabad. Both of them are in Ghaziabad today. I didn't see the face of Archana number 2, but I know that she must be present over here. Archana and Dr. Gulati, I extend a hearty welcome to such an important meeting. Dr. Kiran Pandey is the first speaker. SUI is a very important subject, never ending, adding this and that, every day a new thing, but we must come to the conclusion. And I personally feel that Kiran, being a great academician all through, she will be the master person to present it in the best way for the back home messages. Next speaker, Dr. Patel. I've already talked about him. This POCSO Act, it is a never-ending phenomena. Every government comes and goes and keeps on changing every day, everything. And all of us must learn the best things today. I know that he will be coming up with new things. Medico-legal activities are, I think, they are just circulating all through. Even in the night, midnight, you ask him to start talking on this subject, Dr. Patel will not say no, and he will start it from here and will finish it with that. Lovely chairpersons. Dr. Rakhi, altogether changed, descended down 10 years. Give her a big clap. My friend, philosopher and guide, Kiran Sinha from Kanpur. Another Kiran, one Kiran this side, one Kiran that side, and Kanchan in the center. These are three, pillars for me for all through working. Then Dr. Chitra, thank you very much for being a chairperson over there. And very, very lovely, you see, president and secretaries who are going to stump the great moderator, Dr. Patel. Dr. Patel, I tell you that never anticipate that they are less in anything. Be prepared for anything which is uneventful. And 3% from Kanpur, Kalpana Dikshit, president of the Kanpur Obstetrics and Gynec Society. Then Reshma Nigam, secretary of the Kanpur Obstetrics and Gynec Society. Dr. Rekha, who was earlier, treasurer of our WW Foundation, and Archana, I already know. And most of them I recognize by face, lovely faces. Ritu Jain, and then Sadhna. I'll not take all the names, but these beautiful faces I really recognize, and maybe that their pictures must be with me in my portfolio. So friends, I once again extend my heartfelt gratitude to Dr. Patel for such a wonderful academic activity and with such a long tenure and series. And I personally feel that he will continue doing all these activities all through. And whatever help you need from me anywhere in academic or any other way, you see, round the clock, 360 days, and every day I am available the way I record you. Thank you very much. Now, Kiran and Dr. Patel, they will be taking over the charge of academics. I extend my blessings and love so that they can create very good back home messages. Thank you very much once again.
Thank you. Thank you very much, Meera Madam, for sparing time to bless us. We are always blessed with your blessings in our academic activity. And I am humble for all your words you have spoken for me. Thank you, madam. Thank you.
Now Archana is visible to me. Now it is clear. Archana Verma,
Yes.
now she is clear to me. She was not visible earlier. Okay.
Thank you. Good evening, ma'am.
Thank you, Meera ma'am. Dr. Rekha, are you there? Dr. Rekha? So,
Yeah, I'm there. I'm there.
yeah, please introduce, ma'am.
Yeah. Thank you. Thank you so much for giving the opportunity, Dr. Asha. It's a very noble, and I'm extremely happy to introduce my close friend and my guide philosopher, I can say, Archana Verma, madam. So nice to be connected with madam, not on the academic platform, even otherwise connected to her, and a true friend of mine. Madam is a vice president of Foxy in 2021, founder president of West UP Isopath chapter. She's the advisor of UP COG, and madam is was a chairperson of public awareness committee, and her last, that the third year of her public awareness committee activity culminated in Bangalore, where I was the coordinator at AICOG 2019 Bangalore. Madam, you remember, madam has lot of accolades and feathers on her cap, a highly decorated CV, which includes lot of awards. Since it is a very short CV, I'm supposed to introduce. I'm stopping here. Archana madam, so nice to have you. We greet you in this platform heartily. I request you to give us some words of advice.
Oh, thank you, beautiful Rekha. One Rekha is there in Bollywood and one Rekha in Bangalore. And as Dr. Meera Madam always take naam like this, and I'm great fan of Dr. Meera Agnihotri ma'am. She is the one person who can catch hold the person in government at whatever is position, like Rashtrapati ji. She can do anything, and we have to learn so much from her. Sharp memory, so beautiful, loving each and everybody, remembering all names and doing a lot for everyone. Like she gave me a chance to join the biggest Shapath 1000 program also, and the whatever praises I got in public awareness committee, I want to just tell everybody it was all and all Dr. Meera madam's guidance that she gave me. And I went to Indore and did many big programs with Rachna, and how she she is the one person who can guide and do anything for anyone. I must say, being a chief guest, I think, and the most adorable senior person, Dr. MC Patel, has done wonderful job and of this 171 episode, and we have to learn this, how cool and confident and communication can make things possible. Like Dr. MC Patel also think at least a decade ahead, like our Prime Minister Modi ji and Meera madam. Both of them, I don't want to say anything, only and only I want to praise Meera madam and Patel and all Patel sir and all my friends here. There's like Rakhi, Kanchan, Dr. Kiran Pandey, Dr. Kiran Sinha, and Dr. Sadhna Jaiswal, Rekha, and Dr. Gulati sir. Dr. Gulati is another. I think let me stop here and give him the time to talk. And he is a one wonderful person. Thank you, Asha. Thank you, and my all bestest wishes to you. You are the one person I have always in touch with you, Asha. And तुम हो तो, जैसे आशा का नाम ही होप है, and we all should have hopes, and everything can be done if we do with trust and hope. Thank you, and thank you for inviting me. And POXO Act is really one thing we need to do for our kids and women, especially girls, especially because this is something we have to look for offenders, and how can we protect our girls, and what where and how to act, and what are the basis where we can our judgment and justice will our whatever things we do, and how we work, and this will definitely provide justice to the victims. And this is something very, very important, because we as a doctor need to save the society also, community also, not only just doing deliveries and cesarean. There's something medical legal is another part where we are concerned and bothered about our own friends and our own patients. Thank you very much.
Thank you
so much,
for
Archana
sparing
madam.
time. Of course, you are always with us in any of our activity, and you have spared time today also. Thank you. Thank you very much.
Thank you, Archana ma'am. Thanks a lot for your blessings. And
Thank you, Archana madam, for your concern regarding the medical legal aspects of our fraternity. Thank you.
Rekha ma'am.
Yeah. It's again another proud privilege of mine to introduce none other than senior sir, that is SS Gulati sir, who is the senior consultant in Sharda Hospital of Greater Noida. Sir was also the ex-head of the department in Department of OBG, Sharda University, Greater Noida. Sir was the founder president of Noida Obstetric Gynec Society. Educational qualifications are many. He's participated in many conferences, lot of academic contributions to our society. Sir is keenly interested in cosmetic gynecology and the genital prolapse. Over to you, sir. Gulati, sir. Sir, you are muted yourself. Can you unmute yourself?
Have I done?
Yes.
Am I?
Yes, you are audible, sir.
Fantastic. This is blanked out now. Yeah, can you hear me, sir?
Oh, yes. Oh, yes, you are audible.
Dr. Patel, thank you very much for giving the honor to sit in this meeting. I've been seeing your news greatly. I appreciate your lectures which you are giving to the seminars which you are arranging by eminent speakers of our society. And I've got my best wishes for the galaxy of the ladies in the panel, ladies attending this conference and in the panel. Sir, thank you very much for inviting us. I think the time time is at a premium. So my best wishes for the seminar to continue. Thank you very much, sir.
Thank you. Thank you, Gulati, sir, for sparing time.
No, I won't.
Our bond of relationship is years together, and it is becoming stronger and stronger day by day. And you are always with me in any of my activity. I am blessed. Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you. And so now we start the academic session. Patel, sir.
Oh, yes. Oh, yes.
So thank you all the dignitaries for being present at the inaugural ceremony and blessing all of us. And now we start the academic session. And the first talk is on assisted.
No, it is wrongly printed.
This
Subject
is wrong.
SUI.
The talk is SUI by Dr. Kiran Pandey, ma'am.
Yes.
And our chairpersons are Dr. Rakhi Singh, Dr. Kiran Sinha, and Dr. Chitra Setia. So we all know Dr. Rakhi, and she's had a metamorphosis, Kayakalp. So welcome, Dr. Rakhi, ma'am. She's the president of Noida Society and vice chairperson of UP chapter ISAR, peer reviewer for Jogi.
Asha enough.
Okay. Welcome, ma'am. And we have Dr. Kiran Sinha, ma'am, who's the senior consultant obstetrics and gynecology, Kanpur. She's retired from PMHS as joint director, Kanpur Mandal, after 35 years of service. She's worked in many district government hospitals, trained and conducted many government-related programs. Presently, senior secretary at COGS, secretary ISOPAP Kanpur, and has chaired many sessions. And Dr. Chitra Setia, who's the senior consultant and head of department Gynae Apollo Hospitals, Noida. She's practicing in Noida since last 37 years and has a special interest in high-risk obstetrics and medical legal issues as well. So she has had many executive positions and has a lot of academic activity. So I hand over to the chairpersons to introduce our speaker, Dr. Kiran Pandey, ma'am.
Should I do it?
Yes, ma'am.
Dr. Kiran Pandey is now big name in Foxy. I don't think she needs any introduction, but just for as a protocol, I will say only 2 lines.
Kiranji, don't follow the protocol. Your blessings are more important.
She is medical chairperson, medical education committee, and I think without doubt she deserves this post. She is also ICOG Governing Council member. She is very good orator, and I think she is the most humble, lovely person. And I always feel honored myself. My name is also Kiran.
Many times, many persons are confused. Kiran Pandey, Kiran Sinha. तो कभी-कभी वो बड़ा मजा आता है. एक आध 2 मिनट के लिए मैं किरण पांडे बन जाती, लेकिन then I had to say, "No, I am Kiran Sinha."
Thank you, Kiranji. Thank you very much.
When she was on chair also, Dr. Asha, can I can tell you, I have
Madam,
never asked anything from her. जहाँ भी रख दिया जिसमें, चाहे स्पीकर चाहे मॉडरेटर, she never said even once कि किरण जी आप हमसे पूछती भी नहीं है. तो हम दोनों का बड़ा वैसा वाला रिश्ता है, पता नहीं कैसा वाला है. With this very short introduction, lovely introduction, I invite Dr. Kiran for your deliberation. That is a very important topic. Every day we see many of us also suffer with this thing. With this very short, I invite you for your deliberation.
Thank you. Thank you very much. Thank you very
Just
much.
a second. Thank you, Sinha ma'am, for that introduction. And Dr. Rakhi, would you like to say a few words about the topic?
Can I add one line?
Yes, ma'am.
Kiran has published a book which is released in this AICOG. So I think that is one of the important things. Secondly, in deciding the vaccination for pregnant and lactating women, our clinical work started, and she was a very good, you see, a helper for me for
Thank you,
getting it
madam.
done.
Thank you.
So
Thank
these
you,
are
madam.
two important things which I just take the name of your book so that everybody can have it.
Madam, I think many would know it is evidence-based management of high-risk pregnancies. And madam, with your blessings, I have also released the GCPR on hyperemesis gravidorum. Rakhi to must be knowing about it already.
These are the two important things which I wanted to add.
Thank you, madam. Thank you, madam. All your because of your blessings.
Ma'am, Kiran is one person who dedicatedly worked hard, and any topic given to her, she would do justice to it. She is a master. That's why she is your student, and that is why I want to be your student also. Over to you.
Thank you. Thank you, Rakhi. You are my all. First of all, I would say you get well. All our good wishes are so nice of you to join it. At the outset, I would say I am very thankful to Dr. MC Patel, sir, and our mentor, teacher, guide, and motherly-like figure, patron, Dr. Meera Agnihotri, our respected chairpersons, the coordinators of the program, for giving me this opportunity. Please allow me to share my screen. Yes, I hope my screen is visible.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, and I hope it is. So I bring you greetings from the Kanpur, and I hope it is changing also. It is changing. Yes. Okay. So without wasting any time, let's start, because the SUI is a very difficult topic, and I would ask in the beginning only excuse from all of you and Dr. MC Patel that I had to be choosy and took certain things, focused on few important things. But obviously the whole SUI is very, very difficult that I can take each and everything in detail. So I've tried to take up those things which in nutshell will give the actually the details about the SUI, the diagnosis and the management, and specifically the surgical management, and little bit of I will talk about the modern management also. Well, it is, of course, let's have to define. It is International Continence Society defines it as involuntary leakage of urine on effort or exertion, or on sneezing or coughing. This we all know. The basic thing, it is because of two things. Either there is a urethral hypermobility or there is a intrinsic sphincter deficiency. So you can see here that is the typical picture. If you see into the outdoor, the patient is leaking like this, nothing has to be further investigated or asked. But still, let's go on detail about it. So just a little bit about how do we differentiate between the stress urinary continence, urgency, and mixed. So the symptom of in the stress, basically the leakage is on the exertion or sneezing, coughing. In urgency, the symptom is complaint of an involuntary leakage, which is accompanied by an immediately preceded by urgency. Patient is going to the toilet. Till the patient is not going to the toilet, she will not feel. Once she goes, then the urgency becomes, and then the leakage again. Now, in mixed, the complaint of an involuntary leakage of urine is associated with urgency and also with exertion, effort, sneezing, and coughing. So that becomes a thing. How do you differentiate? Now, urodynamically, actually, stress urinary incontinence, I told you, if you see something picture like this, nothing, no urodynamics is needed. But basically, it is due to abdominal pressure in the absence of a detrusor contraction that results into the involuntary leakage. In urgency, detrusor overactivity incontinence is incontinence related to an involuntary detrusor contraction during urodynamics. And of course, this is both the things are there. Detrusor contraction is also there, involuntary leakage is also there. Basically, young adult life, if you see, it is only seen in 20 to 30%. Middle age, as the age advances, you can see more, 30 to 40. Elderly women, 30 to 50% women. In young and middle-aged women, stress incontinence predominates. I'm saying middle-aged, not the... In the older women, when we go, then it becomes a mixed. Stress definitely remains most common. But along with that, it becomes a mixed because the urgency also is associated with it. So basically, pure urge incontinence is only in 21% cases. Now, the risk factor, we all know age, parity, route of delivery, obesity, pregnancy, menopause, that is all everybody knows. Now, let's focus on more on this sphincteric mechanism and anatomic support. What happens? The urethral sphincter is considered to be composed of two components. The internal sphincter, which represents a direct continuation of the detrusor smooth muscle, and the striated external sphincter. So it has a two component. Now, the principles which underlie the function of a sphincter are: watertight position of urethral lumen is required for continence. Compression of the wall around the lumen is required. Structural support to keep the proximal urethra from moving during the increase in the pressure, which is actually lost. A means of compensating for abdominal pressure change. And this is... Hello? Neural control is required. So the normal sphincteric function is the result of an integrated interaction among all these factors have to be there. We know the Delancey's theory of urethral support, hammock theory. With the rises in intra-abdominal pressure, the urethra is compressed against the supporting structure and which act like a backboard and prevent the loss of urine. Now, when the supporting structures fail due to those factors which we were seeing, it might be obesity, it might be delivery, it might be menopause or aging, there can be rotational descent of the bladder neck and proximal urethra during increases in the abdominal pressure. If urethra opens concomitantly, SUI ensues. Now, this is the picture which you can see, hammock-like appearance, and this is the anatomy, which we all know how it is. This is the bladder and what happens to the intra-abdominal sphincter, which I just discussed. Now, causes of dysfunction are basically two. From an anatomical point of view, urethral hypermobility, which I told you. Another was ISD, just to revise where we are. Now, causes of intrinsic are, there can be congenital weakness of bladder neck epispadias, congenital weakness of pelvic floor, defective collagen, genetic, aging. Now, this defective collagen and genetic, they actually are the reason of the very young prolapses. Sometimes you must have had the history that the young girl comes after a first delivery only, or even I've seen cases where the girl was not even married and she was having so much lack of the collagen and the genetic factors were there, so she was incontinent. Now, in extrinsic, basically, those factors like parity, HRT, occupation, obesity, menopause, trauma, previous surgery like hysterectomy or drugs, alpha blockers and alpha methyl dopa, etc., they can be responsible. Now, investigations are basically three types. One is to confirm the symptom, next is to confirm the diagnosis, and third is to confirm the cure. Basically, clinical examination, general and local. Of course, you have, like the picture I showed you, if you see there, nothing has to be done, but of course, routine test has to be done, or where it is, there is a doubt. So urine cytology, urine culture has to be done, because sometimes infection might be the cause. Clinical tests, stress tests, STEMIs test, Q-tip test, PET test. Basically, Q-tip test is not these days very much preferred, but if still there are there. Imaging, ultrasound can help you. This can evaluate the urethral neck and the supporting structures, MRI, and even sometimes endoscopy or cystoscopy whenever it is required. Now, to demonstrate stress incontinence, this is the important thing. Incontinence, the woman should have a full bladder. The patient is told, because normally we have an outdoor, the habit of telling that whenever we ask the patient to lie down, we say, go and empty the bladder. So here there's a little bit difference. The woman should have a full bladder. She's told to cough violently, and the escape of urine is noted, positive stress test that can be. The index and middle finger of the examiner's hand, if it is inserted into the vagina and the anterior vaginal wall, which is pressed against the subpubic angle, but note probably without pressing on the urethra. If there is no leakage, means it is STEMIs test positive. So this is these are showing the urethral hypermobility. Now, Q-tip basically shows the mobility of the urethra and bladder neck. I told you that this is not now usually in preferred test. Voiding diary is an important tool. This can help you diagnosing in various conditions in the investigations and voiding dysfunction. PAD test is important. If you are doing it, perineal pad is used to document the urinary incontinence. And the basic thing is amount of loss is calculated by subtracting the weight of the pad before the test from its weight and at the end of the test. And interpretation is how much the weight gain is there. Now, if less than 2 gram of gain is there, it is considered dry. If it is 2 to 10 gram, then slight to moderate. If it is 10 to 50 gram, then it is severe. More than 50 is very severe. So this is how you can grade, if it is possible, that then you have to explain the patient to do it. Now, to just summarize these clinical things, I would, because in short, you have to finally say, in the initial evaluation, the patient desiring to, like we have to do surgical or non-surgical treatment, the history is important, physical examination, demonstration of SUI, and post-void residual urine assessment and urine analysis. These are the 5 important tests. Now, cystoscopy is usually not performed. I told you that. It is only if we think that some urinary tract abnormality or problem might be there then. SU, again, urodynamics can be omitted when SUI is clearly demonstrated. Now, additional evaluations when we do, if in the few scenarios, if there is a definitive diagnosis is not clear, if we are not able to demonstrate SUI, maybe sometimes the reason is patient becomes hesitant. When we ask the patient to stand and cough, and she knows that we are standing there, maybe assistant is also standing, she becomes very conscious and sometimes she is not able to demonstrate. So this fact should be kept in mind. Now, abnormal urine analysis, urgency, predominant mid-urethral incontinence, elevated post-voidal residence, high-grade POPs, evidence of significant voiding dysfunction, and additional sometimes if there is a concomitant overactive bladder syndrome symptoms or failure of prior anti-incontinent surgery. Now, this is a very important. Always in history, ask about this. that prior prolapse surgery or prior anti-incontinence surgery has been done, then our evaluation has to be very, very in detail, and minor things have to be checked at. If the patient who wishes to go undergo treatment, one has to be very carefully counseled about the pelvic floor muscle trainings and non-surgical options, surgical interventions, and potential complications and treatment options that we are going to talk about now. Now, non-surgical options, I'll tell you in detail in the next slide. Basically, just to summarize, there can be continence, pessary can be used, vaginal inserts are there, pelvic floor exercises there. I'll talk about them in detail. Now, surgically bulking agents, which are these days considered to be specifically by the cosmetology, they are considered very important. In the mid-urethral slings, we'll talk about that. Autologous fascia pubovaginal slings, Birch suspension. Now, if the mid-urethral sling surgery is suspected, which is very common till now, although I'll talk about it now, the recommendations are a little different. Either in the retropubic or transobturator mid-urethral sling may be offered. A single incision sling is also a choice in index patients. And if they're informed, they have to be informed about the immaturity of evidence regarding their efficacy and safety. All has to be counseled. One has to give time to evaluate them, because otherwise, later on, if something goes wrong, the patient will blame. So that specific risk, benefits of mesh, alternatives, all the options should be discarded. Now, let's go to the main thing. Yes. So basically, the non-surgical management is pelvic floor muscle trainings, lifestyle modification, pessary, bladder training, absorbent products, and catheters. To tell you a little bit about this, whom we will give the non-surgical. If the patient is refusing to take surgical treatment, or if you find that the patient is unfit, she's pregnant, or there is she's planning a childbearing, then you have to discuss how much problem she is and when does she want actually, or when predominant is actually urgency component, meaning by mixed one, which one is there. Catheterization is a simple end stage method that is preferred only in the, just a minute, sorry. Yeah. Absorbent pads, sometimes nothing, patient doesn't want anything and cannot do anything, then pads are given. Pelvic floor muscle trainings, we'll talk about this, Kegels exercises, vaginal cones. Now then devices, bladder neck support prosthesis or pharetic stimulation of pelvic floor muscle. These are also the option. Bladder training, we all know it is referred as a bladder drill, where scheduled voiding regimes are gradually progressive voiding intervals are increased, and this is done. Then another is timed voiding, fixed voiding schedule that remains unchanged over the course of treatment. Bladder training, the interval goes on increasing. In timed voiding, fixed it is. Then there is a habit training. Toileting schedule that is matched to the patient's voiding pattern can also be taught. So the way how the patient feels and how the doctor feels more suitable for the patient can be done. Now, teaching pelvic floor muscle control. The first step in training is to identify the pelvic floor muscle properly and to contract and relax them selectively without increasing intra-abdominal pressure of the bladder or pelvic floor. Good results are only achieved when patient is able to repeat them 45 to 55 times. And basically how well one has been explained, if actually done, initial mild SUI, they can definitely help in improving the muscle strength and the contractions can be sustained. Now, these contractions have to be sustained for 2 to 10 seconds and by 4 seconds rest. So this, I mean, like when you explain these pelvic floor muscle control, then you have to be very particularly explain them. Otherwise, if she's doing for a few seconds, doing 10 times, it will not help her. So if you want her to do, explain them. Now, this is commonly used in combination with other agents, that then it gives a little better results, better outcome, like biofeed mechanisms, intravaginal resistance devices, electrical stimulations, vaginal cones, which I'll show you. And this, if they are in combination used, then they give better results. Now, this training, again in detail, let's not, we save the time and we'll go accordingly. I'll just show you, these are the vaginal cones which can be used. And this appropriate weight of cone is determined. And then women attempts to retain the cone for increasing length of time and increasing the levels of activity. And we have to see which one she can take it. That is why, and she has to retain them and walk for a minute. So this is how much weight she can retain. That is the important thing. Now, these are another urethral inserts. These are sterile inserts placed into the urethra by the patient and removed before a void. So depending on that, they can be. There are certain drugs also, alpha-adrenergic agonist, tricycle antidepressants, etc., etc. I'm not going to focus on drugs, because then it's a very, very different phenomenon, and we have to use all the effects, side effects, and comparison. I will more like to go on the surgical management of SUI. Now, these fall into two categories. The procedures are to stabilize the bladder, neck, or urethra, and these operations are called colposuspension, MUTs, midurethral slings, or autologous rectal fascial slings. Now, these I'll talk about. These are very important. Now, second is the procedure to augment urethral closure, classically to treat the intrinsic sphincter deficiency, and which can be by the bladder neck injections or artificial urinary sphincter. We'll discuss them also. NICE recommends colposuspensions and autologous slings as first-line surgical treatment for SUI. Although, personally, I say I don't, the people do use this autologous slings, but I usually use still these synthetic ones. The procedures, if you can say, they become two, as I said already, colposuspension and MUTs. Colposuspension can be done open, laparoscopic, I don't know, maybe robotically also. I've not written it here. MUTs, retropubic tapes, on transobturator tapes. These are the two common ones. The single slings are also there. We'll little bit discuss about. Now, this colposuspension, this operation is performed via low transverse suprapubic incision. It is an extraperitoneal procedure. Within the retropubic space we have to go. And the aim is to create suburethral support at the level of the bladder neck. The distal bladder, bladder neck, proximal urethra are swept medially off the I'll show you the picture also. Swept medially off the underlying anterior vagina, and which is with the help of a finger in the vagina, which is tenting it. And then let me show first the picture, then you can see. This is what I'm talking. The sutures have to be taken like this. So 2 to 3 sutures are placed into the pubocervical fascia on both sides of the bladder neck. And then they are anchored to the iliopectineal ligament, Cooper's ligament, and along the posterior surface of superior pubic rami. Now, the sutures are tied. Naturally, they will elevate the anterior vagina and creating the bladder support. So, colposuspension, it is still recommended by the NICE also, I told you. Now, this is the picture. You can see the, this is, you can see these sutures on both the sides, and they are on the on both the sides of the urethra, and they are bending it up. Now, the stress incontinence surgical treatment efficacy trial, where the subjects were studied were 655 from 2002 to 2006. The surgery which was done was naturally Birch colposuspension and also autologous rectal fascial slings. So this is a clinical trial. 2 of them were compared, and the result was sister trial compared the Birch-Colpo suspension with the autologous facial PVS, which favored the autologous fascia due to the lower retreatment rates. And that is what the recommendation is of the NICE is. Now, complications of this are injury to the bladder in 2% cases, voiding difficulty in 10% cases, new or worsening overactive bladder syndrome. That's what I said initially also. And actually, basically, always remember in surgical treatment of SUI, that what I was taught with my teachers is do 80% correction. Don't go for 100% correction, because then overcorrection is more harmful. You can always tell the patient that the problem will be solved 80%. If it goes to 90, she'll be more happy even, and she'll adjust to that. An increased risk of rectocele and enterocele formation also may occur in 14% cases. There is a dyspareunia and post-op urinary retention, and then naturally infection and other complications. Now, the second group is mid-urethral tapes. Mid-urethral tapes, MUT, creates suburethral support at the level of mid-urethra. This support allows the occlusion of, this is the second group, occlusion of the urethra against it, and when there is an increase in abdominal pressure. Now, these tapes are made of polypropylene and are inserted using either a retropubic tape or a transobturator tape. I have showed, just a minute, where is this? You can see this is the retropubic seen, and this is the transobturator. So comparative position of both the tapes you can evaluate. And this is passing through the obturator foramen, and this is just next to symphysis pubis bladder. And here are our obturator foramens passing, nerve, artery, and vena passing. These have to be taken carefully seen. Now, retropubic tape, single suburethral vaginal incision given and 2 suprapubic skin incisions are made. Trocar are passed using the bottom-up approach. I'll show you this bottom-up approach from the vaginal incision into the suprapubic incisions to deliver the tape into the extraperitoneal retropubic space. This is the basic principle. You can see here the urethra, the tape is going here suprapubically from this side and this side. This is the base of the tape should be tension free. That is a very, very important. Otherwise, retention will occur under the mid-urethra to reduce post-op voiding difficulty. Second is pass trocars as close to the posterior surface of pubic symphysis to avoid the bladder injury. That has to be seen. And in fact, if needed, the cystoscopy can, in fact, needed, it should always be done cystoscopy to see if that the tape is not going through the bladder. That should be always be checked. Avoid lateral deviation of the trocar to prevent injury to iliac and femoral vessel. So laterally, the chances of injury to iliac vessels and femoral, and medially there is a bladder. So you have to be very specific and should be done by the trained persons. Transobturator tapes. Now this is a single suburethral vaginal incision is given to groin skin. There were 2 suprapubic. Here it is groin incisions. Lateral to the labia majora are made. Trocars are used to insert the tapes using an inside out from vagina to groin or outside in technique through the obturator foramen. Now this is the incision site, you can see, and here you see this is how the tape goes from one side to other side. Now, if we compare these results, the cure rate, bladder injury, vaginal mesh exposure, groin pain, suprapubic pain, voiding difficulties, new urgency and urge leakage, bladder urethral erosion, major vessels, blood injury, then you can see injury, visceral injury or major vessels are very less in transobturator. Success, even bladder erosion is also less. Complications are, if you see, throughout less. Exposure rate mesh is same and the little bit cure rate is less. But otherwise it is, if the patient, if the surgical skill is not so expertise, surgeon is not expertise, and wants to avoid complications, this is quite a good method. I personally have used this method a lot, so I think its success rates are quite good. Now, third comes the autologous rectus facial slings. Now, it is usually carried out both by abdominal and vaginal incisions. In the original sling was Eldridge sling. Here, a strip of rectus fascia, approximately 15 to 20 centimeter into 1.5 centimeter width, length is 15 to 20 centimeter. This is harvested through a low transverse abdominal incision. A retropubic space is created, as you saw in the diagram. It is the operation is the same as the retropubic. It is only thing this autologous facial sling is created from the rectus. So it is entered and the bladder neck is identified. Suburethral vaginal incision is made and the space on either side of urethra developed and deepened till entry into the retropubic space is gained. The rectal facial slip is passed down from the top and sutured in an overlapping manner under the urethra at the, see here the sling was being taken above. Here from both the side, the slings are coming down and in the overlapping manner, one on the top, they are being stitched under the urethra at the level of bladder neck. So this is a little, suturing technique is a little different. This procedure is presently first-line surgical treatment as recommended by NICE. And here you can see this is the cross-sectional view and the side view is this, right? Now, bladder neck injections, that is a newer treatment. It can be considered if alternative surgical procedures are not suitable or acceptable to the woman. Like most common is the bulking agent, which is used by acrylamide hydrogel. Now, these procedures bulk up the area around the bladder neck to achieve closure of the urethral wall. And the route of injection can be transurethral or paraurethral. You can see in the diagram, this is the urethral implant and this is the injection needle. And they are used to, with the pressure, they close it. But as far as I have gone through the studies, they are have a limited ability to give the success and not the first line. They're not the first line treatment or the long-term treatment. They have to be repeated. Exactly how much time I cannot say, but they have to be repeated. Now, here you can see, just a minute. Sorry, just let me go back. Yes. So here you can see this is the weak urethral wall. This is the bladder. And here the bulking agent has been injected into the bladder neck on both the sides. Now you can say the bladder neck is being sealed, preventing the leakage. So that is the idea of these bulking agents. I can to this video also. If you inject at one place, wait for 30 seconds. So the pressure is equalized. Then give second and then give the third. With the 3 injections, you see beautifully it is it. Now this is the actual, that was the animated. Sorry. Just a minute, can I do better? Yeah, this is how it is approximating. Okay. Now, this is just a comparison of the slings. Here you can see this comparative so that one has a mental picture. This is the retropubic slings. This is the urethra, suburethral lesion. It is going from one side to other. Now, this is the transeptal coming out. The both ends are coming out from the obturator foramen and there is this. Now, here is another sling. This is single incision, mini urethral slings. Now, you can see the difference. Here, the single suburethral, the incision has been given here dissection is done, the sling is kept, but it is not taken out from the obturator foramen. So it is only kept there. Here, this is to avoid the injuries of the obturator vessels and the nerve. That is one thing. So one has to be, those who are not very competent and about this, they don't have that specific needle which is used for transobturator, can even do this. And at least 70-80% result this also gives. Mesh erosion complications are there, but no bladder erosion and no other complication. Now, this is a picture of autologous, both the side sling taken from rectus sheet and the stitched overlapping with each other. So this is the, I think.
Kiran
Yes.
ma'am, I'm really sorry to interrupt.
Okay, I'll finish. Okay, I'll finish. Just a minute. Oh, I'll just show you a video and then finish it. This is the last. I think you have 2 minutes. You can give me 2 minutes for this video.
Yes, ma'am. Yes.
Right. I'll not take more. So this is you are giving xylocaine with adrenaline injection that will give you proper plane and also the vascularity is decreased. Then a single midline incision is given, and it will be both the flaps are hold, and then with the finger simply dissect on both the sides. And the 2 groin incisions are given where the obturator tapes have to be taken out. And they're just widened so that you don't have to apply too much pressure. It's a very simple, the needle, this is a specific needle which usually comes with the tape itself. So this side, it is a outside in. The needle has been put in the groin incision has been taken out from the paraurethral area. And again, this is a outside in. First, you have to go straight at 90 degree, and then with the help of the finger, which is pointing towards the obturator foramen, with the guiding finger of that, it will be taken out, the needle paraurethrally. And then this is the mesh which is being woven into the needle, and it will go from one side, and this is just to make it extra secure so that it doesn't count. Now it has come from one side, and now it will come from this is again woven into the needle hole, and it will be coming out from the second side. Yeah, you can see the mesh very clearly, and then we will simply stitch it. Nothing much has to be done. So you see this, personally, I feel this is a very simple, and if you take soft propylene mesh, which are these days very good meshes are available, and if the paravesical tissue is good enough stitched with it, then usually the mesh erosion also doesn't occur. So, thank you very much, Dr. Asha. I'm so sorry if I took 1 or 2 minutes more. So with this, thank you to the respected chairpersons and my friends. Let me stop here for your patience listening. I hope I've been able to give few messages for SUI.
It was a lovely to hear to you, Dr. Kiran.
Thank you.
Talk and explained every bit by bit, step by step. And believe me, I have been hearing SUI after a very long time. It was superb. I enjoyed your whole talk.
Thank you so much. Thank you.
Dr. Kiran Pandey, can I ask you one thing?
Yes.
मैंने आपके पास when you were in the medical college, I've sent you two or three cases. You have done it very beautifully because the patient after that operation, they came to me and they were very much satisfied. At present, I don't remember their names. और
Thank you.
उसमें बस ये जो आप ट्रांस ऑपरेटर वाले करते हो जो दोनों तरफ से स्लिंग डालते हो, then you tie it or you just leave it?
No time. You just leave it as such and see that there is no tension also suburethral. With the fibrosis, it itself remains. That remains itself.
That is TOTO, trans obturator tape tension free. Yeah, tension free. Okay. I think simple also, na? लेकिन
It's
जब तक
simple
वो-
comparatively. That is what
हाँ.
I said. Ki if the person is not having much expertise, even simple, that single sling can also be there, and this one is also very good.
It goes very beautifully inside.
Very, हाँ, that
Very
needle का curve जो है वो बिल्कुल वैसा ही है.
अच्छा जब आप ग्रोइन में वो डालते हो इंसीजन लगा के इसको वाइडन करते हो तो उसका कोई लैंडमार्क है कितने सेंटी इतने डालना कैसे हाउ
Yes, it is given into the book. मैं I'll explain it. वो एक टिप से वहां से एक लाइन बना के वो ड्रॉ कर लेते हैं. टाइम कम होने लगा इसलिए I was that is what saying SUI में इतना था. I thought क्या दूं क्या ना रखूं. So I just
वेरी वेरी गुड.
Thank
मैंने
you.
सारी स्लाइड की फोटो कॉपी ले ली अब सब प्रिंट हो जाएगा.
Okay.
बहुत बढ़िया मजा आ गया.
Thank you. Thank you. Once again, thank you to Dr. MC Patel, sir. Sir has given me chance.
Thank you,
Beautiful
Dr. Kiran.
chance.
I'm really
you.
sorry I had to interrupt, but it had
No,
been
no,
30
I was
minutes, I couldn't
finishing
do
it.
anything. So
I should have remembered. Thank
and
you.
now we would start the panel, please. Sir, are you ready?
Oh, yes.
So, sir, we'll be starting the panel now.
Oh, yes. ठीक है.
I request all the respected panelists, please put on your videos where it's easier to interact. And we'll be starting the panel. It will be on the POXO Act. Here are our respected panelists. And as they come along, I will be introducing them, each one as they come. I would like to officially introduce Dr. MC Patel, sir, who is going for president election this year. He's a consultant obstetrician, gynecologist, and medical legal counselor, vice president Foxy 2018. He is very well known and very beloved to all of us. He has a lot of social work in Foxy, and he's been visiting all societies for years together. So, sir, without a very formal introduction, I would like to play the slide of sir. That's me.
शुभं करोतु कल्याणम् आरोग्यं सुखसम्पदम्.
Respected seniors and dear colleagues, serving Foxy for years together on this auspicious day with folded hands and down head, I seek your guidance, blessings, and support to endorse my candidature for the post of Foxy President year 2026, election year 2024. Consistently working for Foxy and trying to visit even a smaller societies and to assist our common Foxian friends in any given situation, I have tried to serve Foxy. I assure to serve Foxy in the same way with the same zeal and enthusiasm. पथ का अंतिम लक्ष्य नहीं, सिंहासन चढ़ते जाना, लिए सभी को साथ, आगे है बढ़ते जाना.
Thank you, sir. Now we start the panel and I will take the introductory slide. That is this POCSO worth discussing for a general gynecologist? And what was the trigger for forming this act? Why was it formed at all?
So it is very important and it is worth discussing for general gynecologists because we are the first person or first person to be contacted when child is brought to us many a times with complaint of sexual assault or sexual harassment and many a time for other reason also, and we come to know that she is a victim of sexual offense or she is being victimized for sexual offense. So at that point of time, we have to examine her, we have to treat her, we have to form opinion, we have to collect evidences, and we have to inform police. So that way, even a common gynecologist practicing routine OBGYN practice are also under obligation to know this law and not to end up into litigation related to POCSO Act. And this very act was enacted in 2012 and it was amended in 2019.
So
But
that
when
we will
this-
take later, sir.
Okay.
I'm just asking you that, why did the government think of making this act?
Yes, I am coming to this. So in 2012, when this act was enacted, so full form of POCSO is Prevention of Children from Sexual Offenses. So it was basically to prevent sexual offenses against any children who are victimized in this type of situation. So this was the aim of government to protect those children, to form special courts for this, to run all these cases of POCSO Act, and to form CWC, that is Child Welfare Committee, to take care of this type of victimized children as far as this POCSO Act is concerned.
Thank you, sir.
Yes.
Sir, our next speaker was going to be Dr. Ritu Jain, but she has dropped a message that she is not able to join. She is the current president of Ghaziabad Obstetric Gynec Society, and her hobbies are singing, traveling. She works in a NGO in Uttarakhand for free healthcare, counseling and awareness. So I would request somebody from
Anybody from Ghaziabad can
take this question.
Anybody can from Ghaziabad. No issue. Is anybody from Ghaziabad?
Yes, sir. Archana ma'am is there.
Yes, welcome, Archana madam.
Thank you, sir, for giving me this opportunity. So first we must understand who is actually a child.
So under this POCSO Act, any person who is less than 18 years of age is child.
And whether it covers the boys also or not?
Yes. So this act is gender equal. So it covers both male and female.
Yes, sir. Then we must understand what is exactly the POCSO Act.
So I just mentioned it is prevention of children from sexual offenses.
So now we have Dr. Manisha Jain ma'am, and she is the secretary of Ghaziabad Society, and she said that she likes learning new things and is digitally upgrading herself, and she also loves cooking. She unfortunately didn't share photographs. So Dr. Manisha Jain ma'am. I don't see her. Again, somebody else will have to take that question.
Hello, good evening.
Anybody from
So
Ghaziabad
if you,
can-
sir, if you permit, I'm Dr.
Oh, yeah.
Aradhana Singh. I can.
Yes, you
ask-
can take. You can
So,
take.
sir, good evening, everybody.
Yeah.
Thank you, sir. So what is the provision of punishment for this under this POCSO Act, sir?
So there are different punishment as per offense. So from sexual harassment to sexual assault, aggravated form of sexual assault, penetrative form of sexual assault, aggravated form of sexual offense, and child using for pornography. So it ranges from 3 years of imprisonment to lifetime imprisonment, and in few of the cases, death sentence may be awarded in a certain condition. So these are the provision of punishment, and it is not only imprisonment, but fine is also awarded, and fine should be reasonable, and that very amount of fine is to be given to a victimized child for medical expenses and for rehabilitation purpose. So this is provision as far as punishment is concerned. And as far as this child pornography is concerned, if it is very first time when child is used for pornography, then imprisonment is for 5 years. And if it is second time or more than that, then more than 7 years or so is the imprisonment with fine or with both. And in that very, as far as pornography part is concerned, if person, he or she is involved in that very pornography with that very child, then again that person who are involved will invite sexual assault or penetrative form of sexual assault as per the case may be, and there will be stringent punishment for those persons who are involved in that very pornography. So due to child pornography, 5 to 7 years, and if they are involved themselves, then additional punishment is also be awarded with fine or with both.
Thank
So
you, sir.
it means
Thank you.
it is minimum is 7 years.
Minimum is 7 years.
Yeah.
Okay.
Fine.
Thank you, sir.
When anybody is involved, otherwise
But
if
5 years,
child,
you also mentioned 5 years for pornography.
for first time, but then after 7 years and above 7 years.
Thank you, sir.
So, sir, now we have Dr. Sadhna Jaiswal, ma'am. She's an art of living teacher. So she lives a art of living and she also teaches it. She does awareness and camps. She's taught meditation to more than 3,000 people and she's had more than 300 camps. These are the images that she has. She's a really quiet person. She's the president of Greater Noida Obstetric Gynec Society. So over to you, Sadhna, ma'am.
Thanks, Dr. Patel, sir, Dr. Asha Jain, for giving me this opportunity. So my question to you, sir, is that what were the amendments in the POCSO Act till now?
So basically this act was enacted in 2012 and amendment came in 2019. So in that very amendment, one amendment was that fine which is awarded to the accused should be reasonable in amount, and that very amount is to be given to child or children who are victimized for their medical expenses and for rehabilitation purpose. But one more amendment which was came in 2019 as far as this amendment in IPC is also concerned. Because in that very amendment, it was in section 376, that is punishment for rape, because under section 375, rape is defined, and in 376, a punishment for rape is defined. So with their amendment in 376DA, if child is less than 16 years and when more than one persons are involved in that very act of sexual assault or penetrative form of sexual assault, then all the persons involved will be considered as a person acting in a furtherance of common intention, and they will be punished equally in that very act. If one person has done this act and other persons have helped him to commit that offense, then all the persons will be taken into consideration. This was amendment in 2019. And for that, imprisonment of lifetime and fine are decided and they can be awarded. But in the same amendment, it was also mentioned that if child is less than 12 years and in this situation when more than one persons are involved, then again they will be considered as acting in a furtherance of common intention, And in this case, punishment is life imprisonment and fine. And in few of the cases, death sentence is also awarded. It was amended in 2019. So these were some amendments which were made in POCSO Act as well as in IPC.
Okay, thank you, sir.
Yes.
So we have Dr. Samta Gupta. She is the Secretary of Greater Noida Society, but I could not actually contact her. Samta ma'am, are you there?
Yeah, ma'am, I am there. Thank
So
you, ma'am.
just a couple of
inviting me.
lines about your hobbies and then you
Yeah, ma'am, sorry for not sharing that. In fact, I love to spend my time with my two dogs. That is one of, I really love the animals and I love to spend time. So that is my pastime, which usually is the what
I
I
would
do.
have loved to have photographs, but anyways,
Yeah, sure.
welcome, ma'am.
Thanks, ma'am, and thanks, sir. So, sir, I would like to ask, what is aggravated form of sexual assault? When do we call it as aggravated form?
So when person who is involved in this sexual act, that is accused, if he is in a position of trust, say for example, family member, so child has trust in that very person. Say for example, school teacher in school, doctor in hospital, police officer in police station. So they are in a position of trust. And if they commit this offense, then it is considered as an aggravated form of sexual assault.
And sir, what about penetrative and aggravated penetrative sexual
Yes.
assault?
So as far
When
as
do we call it?
penetrative sexual assault part is concerned, so if any person in this POCSO Act, it is very clear in each and every definition of all these offenses, whether it is sexual harassment or sexual assault or penetrative sexual assault, one word is commonly used, that is sexual intent. So any person with sexual intent penetrates his penis or any object or part of body to any extent into vagina, mouth, urethra, anus of child, or make child to do so with him or any other person, is a penetrative sexual offense. It is not necessary penetration should be full. So up to any extent, if there is penetration, it is penetrative sexual assault. It is also clarified that when a person manipulates any part of body of child to penetrate into vagina, so he will instruct child to do so with his own finger or so, then also it is considered as a penetrative sexual assault form. And if he applies his mouth, penis, vagina, anus, urethra of child or makes child to do so to such person, it is also considered as a penetrative form of sexual assault. And just I mentioned about aggravated form of sexual assault. Same way, if it is act of penetrative sexual offense by a person who is in a position of trust, just I mentioned about family members or police officer in police station, doctor in hospital, teacher in school, then it will be considered as an aggravated form of penetrative sexual assault.
Okay.
Yes,
Thank
next.
you. Thank you, sir. Now we have Dr. Kalpana Dikshit, ma'am. As you can see, she likes dancing, badminton, swimming, and she also loves her family. So these are her hobbies. Over to you, ma'am. Dr. Kalpana Dikshit, ma'am, is the president of Kanpur Society.
Thank you, Dr. Patel, sir, and Dr. Asha for inviting me. My question to sir is, what is sexual harassment?
So, as far as sexual harassment is concerned, just I mentioned prior also, any person with sexual intent, everywhere in this POCSO Act, word sexual intent is very much important and it is used that way. So, if any person with sexual intent repeatedly or constantly follows any child to contact directly physically or with electronic media, digital or any other means, or threats to use the form of media, and any person with sexual intent utters any word or makes any sound or makes any gesture or exhibit any object or part of his body, and intention is such that such word or sound shall be heard, and such gesture or object or part which is shown to the child will be seen by that very child, or makes a child to exhibit his body or any part of his body, then it becomes an act of sexual harassment. In this sexual harassment, no need to touch. See, merely uttering some words or exhibiting any object or showing any picture or any object, it becomes a case of sexual harassment. But again, word sexual intent is very much important, because in this person should have
Intentions.
intention of sexual intention. And
Okay.
many times if he or she shows any object, any picture or any object to child in any form or in media or in pornography purposes, then also it is considered as a sexual harassment.
Thank you. What is sexual assault?
So
And
as
the
far
difference.
as sexual assault is concerned, so whenever any person, again with sexual intent, touches vagina, penis, anus, breast of child, or make child to do so, to touch vagina, penis, anus, or breast of that very person, or does any other act with sexual intent which involves physical contact without penetration. Here, mere contact is necessary to prove the crime. No penetration is required to prove sexual assault. So, in this situation, it is considered as a sexual assault.
Thank you, sir.
Thank you, sir. Now we have Dr. Reshma Nigam, ma'am. She is the secretary of Kanpur Society and she loves plantation. So you can have a look at her garden, the various plants and flowers, and the prizes she's getting for it. And there's also Meera Agnihotri ma'am there and Kiran Pandey ma'am there as well.
So, we will have to visit Reshma's place to see this
Ah.
beautiful garden.
Yes.
Sir, welcome all of you.
Yes, welcome.
Thank you, Dr. Asha Jain, ma'am. Thank you, Dr. Patel, sir,
Yes.
for giving me this opportunity. Now, all has been discussed about the POCSO, what is POCSO Act and its amendments in 2019, and what is the difference between the sexual harassment and sexual assault. Now, coming to one question, case-wise. A 17-year-old girl comes with a boyfriend and she asks for contraceptive advice. What will you do?
Very interesting question, because this type of situation may come to any of our practicing friend or working in government hospital also, because many times they come to us and they will seek for contraceptive advice. They will say that we are going to start our active sexual life and we do not want to end into any kind of unwanted pregnancy. So please advise us for as far as contraceptive measures are concerned. So in this situation, our situation is very tricky. On one part, it is an ethical part, that is our moral duty, because if we do not advise them, then they will end up into pregnancy, and again they will come to us for termination of pregnancy. But if we advise contraception, then in eye of this POCSO Act and in eye of IPC, it becomes an act of abatement. So what is abatement? First we will have to understand. So if any person instigate any person or helps any person or aids to constitute crime, then it becomes an act of abatement. So if we advise them contraceptive measures, then we are encouraging them to constitute crime under POCSO Act. So it is very difficult for us in this situation. Of course, you can advise them not to.
We advise or you will advise?
Yes, yes. So we will not advise to this type of children who comes to us for contraceptive advice not to enter into sexual life before age of majority, and if at all, you can give them sex education. You can give them what is contraceptive measures, how they work, but you cannot prescribe, because once you prescribe, it becomes a evidence. And if any investigating officer wants to harass you, then with that mere prescription, in with that very prescription, if you advise any contraceptive measures, then it will be very difficult for you to get rid of this problem. Of course, if she is for any medical problem, say for example, PCOD or irregularity in menstruation, and if you have advised any contraceptive measures, I mean pills, as a part of treatment, then it's fine. It is pardoned. But merely for contraceptive measures only, you cannot prescribe.
Thank you.
Yes. Yes, next.
Now we have Shalini Agrawal, ma'am. She is the senior consultant at Khora Makanpur. She loves environment. She does gardening. She's also learning classical music and is in the 4th year and has immense work on plastic recycling. So I welcome Dr. Shalini Agrawal, ma'am. Not here. Anybody from
Anybody from Khora Makanpur can take.
Actually, don't see anyone from Khora Makanpur, sir.
So anybody can take.
Anybody can
I
take
can
this.
take it. Yes, yes, I am taking this.
Go ahead,
A
please.
16-year girl brought by her mother complaining of vulvovaginitis with the discharge per vaginum. On examination, it is found to be a case of STD. And she gives the history of sexual exposure with her boyfriend. Now, what will you do in such a case?
So here she is 16 years, that means she is minor. And of course, she was brought for complaint of vulvovaginitis and discharge per vagina. But on examination, we could found out that she is a case of STD. And on further interrogation, she revealed history of sexual exposure with her boyfriend. So it becomes a case of POXO. Of course, we have to treat this patient, but at the same time, we are under obligation to inform police.
Thanks.
Yes, next.
Now, Ritu Mittal Arya, ma'am, she is also secretary of Khora Makanpur. She said she'll join, but she's not here. So requesting someone, please take these questions.
Yes, very good evening, sir. Can I take this question?
Oh, yes. Oh, yes.
So now we are moving on to the clinical cases actually.
Yes, yes.
It's an 18 years, 6 months old girl. She has crossed 18 years actually and brought by her mother with the pregnancy of 39 weeks. And we have to go for the LSCS. What should be done? What will we do? And how we are going to proceed with the LSCS is really indicated. Or we can go for the normal delivery also. And if there is any issue of child marriage, marriage is not actually confirmed.
So in this case, of course, she is 18 years, 6 months. So she is major.
Yes.
But she is having 39 weeks of pregnancy.
Yes.
So at the time of conception, she was minor.
Yes.
So it becomes a case of POXO. So you have to inform police. As far as proceeding towards delivery, law doesn't teach you medicine, how to manage this case.
Okay.
Whether cesarean section is indicated, of course, you can very well go with cesarean section. If normal delivery is possible, then you can go for trial of labor. So that is not an issue. But she is 18 years, 6 months, and at the time of conception, she was minor. So you will have to inform police. So when will you inform police? If immediate cesarean section is required and you have no time to inform, then of course you can deal with situation accordingly. And before patient leaves your premises, you can inform police. But if you have time, then you can inform before surgery also. As far as child marriage part is concerned, so when she is less than 18 and if she is married, then it is not illegal marriage. It is considered as a voidable marriage in eye of law. So in this situation, when marriage occurs in the partner less than age of majority, any partner can give in writing in court of law to end that very marriage. So they are voidable marriage, but they are not illegal because they are voidable marriage. So in this situation, we have nothing to do with that, whether they are married or whether they are not married, or whether they are with child marriage or with voidable marriage. We have to simply inform police. As far as child marriage part is concerned, they will invite some other charges also, but that is a duty on part of police. We have to simply inform police that that very patient, when she conceived, she was minor and it becomes a case of POXO.
Next, we have Dr. Aradhana, sir. And
Yes.
she does poetry writing. And this poetry she wrote yesterday. So I would really love if she will recite it for us. She is the past president of Noida Society. Aradhana, ma'am.
Yeah, hi. Thank you. Thank you so much.
Yes, welcome. Aradhana.
Thank you, ma'am. And sir, once again, thank you. So
Yes.
yesterday only I have written this poem.
Very good.
So I just recite. It is just a minute.
It's there on the screen.
Yeah. Yeah, Ram तुम्हारी. So it is on the Ram, yesterday's
Yes,
जो पूरा हमारे भगवान राम का राम तुम्हारी सहन शक्ति आज भी बन रही हमारी शक्ति, नित हृदय में वंदित और स्पंदित तुम्हारा एक नाम जीवन प्राण है राम। तुम चले त्याग जब राज सिंहासन, दिया त्याग और बड़प्पन का उदाहरण, पिता की आज्ञा सर आंखों पर और छोटे भाई पर सर्वस्व निछावर। तुम्हारे संग संग सीता माँ प्यारी, नंगे पांव चली सुंदर सुकुमारी, मर्यादा पुरुषोत्तम की अति उत्तम जीवन संगनी, जहां राम वहां सीता सदा सुख करनी। सब जन रोए थे तुम मन, अश्रुधारा बहे जहां पड़े तुम्हारे चरण, पर किया पिता की आज्ञा का संरक्षण, लौटा न पाया तुमको कोई भी जन। केवट की नाव में बैठ गए और वो तारणहार को तार के तर गया, भक्ति की शक्ति का वो क्षण उसके जीवन को सुदर्शन कर गया। राम तुम्हारे दास हनुमान, जो है पवन पुत्र सदा बलवान, नाम लेने से ही पीड़ा हर ले, चहुं ओर हो अगर बस राम नाम। रावण भी तुमसे वध होकर तर गया, ये आखिरी 4 लाइनें हैं। रावण भी तुमसे वध होकर तर गया, तुम जिसे स्पर्श कर दो वो सर्व समर्थ हो गया। राम आज तुम फिर अपने मंदिर में स्थापित हो रहे, सर्वशक्तिमान सर्वेश्वर शाश्वत सदा मुस्कुरा रहे। थैंक यू।
Very nice. Very nice.
Very good. So इसीलिए भगवान राम को मर्यादा पुरुषोत्तम कहा जाता है। जितने भी राम के जो चरित्र के लक्षण है तुमने ये कविता में बताए, सब इसमें आ जाता है। इसीलिए तो उनको मर्यादा पुरुषोत्तम कहा था कि हमारे मानव जीवन की मर्यादाएं क्या क्या होनी चाहिए, ये सब तुमने एक कविता में अच्छी तरह से ले लिया है।
थैंक यू।
बहुत बहुत बधाई।
थैंक यू सर। थैंक यू।
यस,
ये कल ही लिखी है, एकदम फ्रेश।
यस।
So sir, now so move on to a 17-year-old girl with mother visits to hospital with 6 weeks of pregnancy for termination of pregnancy. So do we need to inform the police, and patient and mother fetus refuses for the same and leave the hospital without taking any treatment further, then what to do, sir?
So in this situation again, she is 17 years, so she is minor and it becomes a case of POXO. Even if she takes treatment further with you or not, but once you came to know that she is minor and she is pregnant, so it becomes a case of POXO and you have to inform police.
Okay, sir.
Yes.
But there's just a query, sir. Suppose if
yes.
we are doing emergency cesarean, like we discussed, then I mean, are we liable for we did it in emergency, we could
No,
not
no.
inform the police.
Just like I mentioned prior also,
Yeah.
law doesn't teach you medicine. You have to manage any patient accordingly in that very given situation, way in which any prudent gynecologist would have managed. So you have to manage that very patient. But if she is minor, or at the time of conception she was minor, then you have to inform police before that very patient leaves your premises.
And hospital authorities, should we take the permission with them? Of course, I think.
So if there is a guideline in your in any big hospital that all this situation should be narrated to the head of the unit or head of the department or head of the institution, and through that very proper channel, police should be informed or CWC person should be informed, that you can do like that also. But in few of the situation we have observed, because during my medical legal practice we have faced this situation also. Say, for example, you are working in one unit and you came to know that it is a case of POCSO. You informed your head of the unit, but for any reason, head of the unit didn't inform head of the department, or head of the department didn't inform head of the institution, and they didn't inform police. So ultimately, you will be in trouble, because under this POCSO Act section 19, you are under obligation to inform police whenever you come to know that it is a case of POCSO. So even if it is a tradition or protocol or guideline in that very institution, then also you will see that that very person has informed police. Otherwise, you will have to inform police.
Sir, if they ask us to maintain the secrecy of them?
So in this POCSO Act, when you inform any authority, that is authority of law, then it doesn't become breach of confidentiality. If you reveal this information to third party, then it becomes a confidentiality break. Otherwise, if you inform police, or if it is protocol in your hospital, and if you inform your senior one in a seal cover, then it doesn't become a case of breach of confidentiality.
Good point, sir. Thank you. Thank you.
Sir, I want to ask something.
Yes, yes.
That in this patient, we could have
Shweta.
given MTP medication to this patient?
Yes, yes. If your center is registered for MTP under MTP Act, if you are qualified, then you can very well terminate pregnancy. But at the same time, you are under obligation to preserve product of conception in saline. And again, that very product of conception is to be handed over to the police for further investigation. And you will inform police before going for termination of pregnancy that this patient
Is for oral medication,
it is a
we
method.
can give, and
Whether you go with oral or whether you go with surgical, it is a method. But you will have to inform police that you are going to terminate pregnancy of their very patient. If you are given medical method, then you will admit their very patient, and whenever she goes in bathroom, you will instruct them that any product of conception she passes, she will collect and it will be handed over to you, and you will preserve it in saline. It is very important.
Okay,
Thank you, sir.
Thank you, sir.
Yes.
Thank
Sir,
you, sir.
now it is actually Dr. Shweta's turn only.
Yes.
And you can see that she loves to travel and do adventure activities. So snorkeling, night paddle boat, paragliding, water tricycle, and yoga, which she started during yoga. And see the pictures. Oriji has made snorkeling so the in thing now. And she's really been able to do some poses very difficult. So welcome.
Thank you, ma'am. Thank you.
Officially welcome Dr. Shweta. She's the past
Thank you, ma'am.
secretary of Noida Society. Your question.
Yes, sir. We are saying that we have to inform the police if an adolescent is coming with STD or pregnancy, and especially if the patient has brought with the police for examination. So how all we inform the patient, what all documentation we do, how to examine the patient. So, can you explain in detail how to inform and all?
Yes, I mentioned prior also, we are the first point of reference in this type of situation in confirming that child has been or being abused under this POCSO Act about sexual offenses. So in this situation, we have to start with consent, because before going for any patient for any examination, we have to take consent. If child is more than 12 years, then child himself or herself can give consent. If she is less than 12, then consent of guardian is required for examination. So consent, then history. History is very important. History of this act in patient's own language. And we have to enter all this in record. Whatever question we put before child and whatever the reply or answer on that on part of child, we have to write in that very history. Then examination proper. So any injury mark on face, on perineum, on breast or any part of body. And then collection of evidence during examination or after examination also. Collection of, say for example, undergarment for blood stain or semen stain or any other stain or any other part or any other evidences we have to collect for evidence. And then we have to form opinion that whether this child was victim of sexual offense, and we have to treat that very patient. It is very much expected. We have to go for prophylaxis of STD also, because we never know that the accused person could be HIV positive or so, and this child could be victim of STD also, HIV infection also in future. So we have to go for prophylaxis of STD also. And after all this, we have to form opinion and we have to inform police. And whenever we are called in court of law to opine, then we have to opine as far as our opinion, and we have to justify our opinion with all the evidences we have collected and we have handed over to the police.
Thank you, sir. So, like we call 100 number, how do we inform the police? We make a written report on our
Yes,
letterhead. hand it
usually
over to the
whenever
police
we
station.
inform police, we should inform with acknowledgement. So whenever you send any of your person with letter in 2 copies, then 1 copy is to be handed over to the police, and our office copy is to be signed by that very police station officer as far as acknowledgement of that very letter is concerned. So at that point of time, we should be very careful who has signed that very document, name of that police station officer, buckle number, because they are given a number, buckle number. So buckle number, time and date of information is very much required. Because acknowledgement is required, because many a time police may go hostile. They will say, you didn't inform, you never informed. Then it will be very difficult for us to prove that we had informed. So always inform with acknowledgement. If police refuses to give acknowledgement, because many times it happens, when you send person with seal letter, they will not sign any document. So in this situation, there are other means also as far as information to the police is concerned. You can dial 100. Dial 100 is recorded call. But when you inform on number 100, you will identify person whom you are informing. So name of that very person, buckle number and date and time. And then you will inform. And it is recorded call. So it is good evidence. You can inform by registered AD post also. You can inform by email also. You can inform from your mobile if you have facility of recording in your mobile. But again, in this situation also, you will identify the person whom you are informing. If lower station police officer is not complying to give acknowledgement, then you can inform higher officer also. Or you can inform member of CWC, that is Child Welfare Committee. So if you inform member of Child Welfare Committee, then he will be in action and they will approach police station, and police will not take it easily, because Child Welfare Committee members are always taken in seriously. So these are some means as far as to inform about this act.
So one more thing that it
Yes.
says that we don't have to charge. This service has to be provided free.
So
So
when this type of children are brought to us in an emergency, then for that very period we have not to charge. But after emergency is over, when patient is stabilized and further treatment is required, then we can offer them options, whether they want to be treated by us only in the same hospital or they want to go to another hospital. If they want to go to another hospital, fine, they can go. If they want to be treated by us only, then after you can charge. When patient is stabilized, when patient is stable, and after that, whatever treatment you are going to offer, but primary treatment or emergency treatment, you have to go for free.
Excuse
Thank
me,
you,
sir.
sir.
Let us take the questions first, sir. Then we can take
Yes.
the extra
Yes.
questions at the end.
Okay.
Means we have 6 more people.
Yes.
So we have Dr. Manisha Saxena, ma'am, who's the secretary of Noida Obstetric Gynec Society. She loves reading and she loves watching movies. Over to you, Dr. Manisha.
Good evening, madam. Good evening, sir. Thank you for giving me this opportunity, making me a part of this. Suddenly, today itself, I was going to court for a medical legal case when madam called, Dr. Asha Jain, and asked me about my hobbies. I could not gather what my hobbies are. It took me a time, to recollect what actually my hobbies are. Whatever came to my mind, I just said reading and movies. Thank you, madam. Thank you, sir. So I just wanted to ask that in this kind of cases, sir, what is the duty of a doctor? How to deal with a case of sexual assault?
So I think it is covered with the previous question also.
Yes, previous patient also. So can sedation be considered for examination of the victim?
Yes. So there is provision in POCSO Act if child is not comfortable, because it could be painful to child also. And if examination is very much necessary to come to conclusion whether she is victim of sexual offense, then we can offer sedation also. We can go with short general anesthesia also, because many a time it is not mere examination which is required, but many a time she is bleeding or there is some foreign body inside, then we have to treat that very patient also. So with consent of guardian, because if she is more than 12 years, she can give consent for examination only. But for any intervention or for any anesthesia or for any sedation, we have to take consent of guardian. So taking consent from guardian, we can go for sedation or anesthesia to deal with situation as far as further examination is concerned or further treatment is concerned.
Thank you, sir.
Yes.
Thank you.
So this is Dr. Archana Sharma, ma'am. She is the incoming president of Ghaziabad Obstetric Gynec Society. She says she's a bathroom singer, so we'll have to listen sometime. And these are photographs of camps that she does for awareness, for cancer awareness. So welcome, Dr. Archana, ma'am.
Thank you very much, Dr. Asha, for such a nice introduction. And good evening, sir. Again, I am here. So I just want to ask you about the consent part, actually. Who can give the consent? And when examination is required, whether if the victim refuses for the examination, then what? Then from which person we should take the consent, which relative? And if the victim is not willing, then we should ask from the relatives. And if the victim is willing, but relatives are not willing, then what to be done?
So
situation,
partly I mentioned prior also, if she is more than 12 years, then she can give consent for examination. And if she is willing for examination, naturally we can go for examination further. And if treatment is required, we can treat also. But for treatment, if any further intervention is required, then consent of guardian is very much required. If patient is not willing to go for examination, and if relative insists, then we should go for examination. then it is very clear. If she is not willing, when she is more than 12 years, then we cannot force her for examination. Of course, we can explain her that what is important of examination, and after examination, we have to come to a conclusion. We have to opine. So we have to explain everything in detail. But after all this, even if she is not willing to give consent, we cannot force. We cannot force. Even if she has given consent and we start examination, during examination also, she can withdraw her consent. And that very point of time, again, we have to explain. And if she is willing, then fine. Otherwise, we will have to stop that very examination. So it is very clear. So
And if there is any,
pardon?
if there is any provision about the presence,
Yes, as far as presence is concerned. So in this POCSO Act, there is a provision that we can allow guardian of patient at the time of examination. But here word of caution, because many a time it is observed in so many of the cases, person who has brought victim could be accused and patient may not be comfortable to be examined in his or her presence. So we have to ask patient separately if she is comfortable for that very person to allow to be present at the time of examination. If she is comfortable, if she allows, then we can allow a guardian at the time of examination. If child is too small, then we can examine that very child in a lap of her mother or guardian or whosoever has brought that very child. So these are some situations we should deal with very tactfully.
thank you, sir.
Thank you, sir. Thank you, sir. Now we have Aarti Tandon ma'am, who's a senior consultant and medical legal expert in Noida. She loves singing and music, a lot of extracurricular activities, as you can see over here, reading, traveling. Aarti ma'am, over to you.
Yeah, thank you, ma'am. I've had the good fortune of interacting with Dr. M.C. Patel, sir, in a number of medical legal forums and conferences, and I have seen his vast experience and in-depth knowledge. He's a stalwart in his field. And
Ma'am, please put on your video. I can't see you.
Huh?
I've already put on the video. The video is
yeah, I got it. Thank you.
No, I can see.
Yeah, yes,
Aarti
sir, I
Singh.
got it. I got it.
Yes, sir. And he's a stalwart in his field. And as he's contesting for the post of the President Foxy, I am absolutely sure that Foxy is really going to benefit under his leadership.
Thank you, Aarti.
Sir, what is the role of doctor as an expert witness in case of sexual assault or rape? And can a doctor refuse to examine a victim of sexual assault who came to the hospital for treatment, citing that it's an MLC case and it requires a police requisition or a magistrate order?
So first part, what is the role of doctor as an expert witness in case of sexual assault? So under POCSO Act, it is very clearly mentioned. And whenever any victim of sexual assault or rape victim is brought to you or comes to you for examination and treatment, you are under obligation, being a responsible doctor of India, to examine that very patient and to offer all the possible treatment at your level. So it is very important role of doctor as an expert witness. And once we examine, once we come to a conclusion or opinion, then we have to form opinion in writing and we have to inform police or CWC, just I mentioned in prior discussion also. So, and whenever we are called in court of law, then as an expert witness, we have to give our opinion with justification, with history, with examination finding, with evidences, we have to go for that. And as far as this second part is concerned, can doctor refuse to examine victim? No. He or she cannot refuse examination of sexual assault merely on that ground, citing that it is MLC case and require police requisition. No police requisition or magistrate order is required. Whenever patient comes alone or when patient is brought by some relative or guardian, you are under obligation to examine patient and to treat patient in that very given situation. No police requisition, no magistrate order is required. Of course, you are under obligation to inform police if she is minor and if she is case of sexual offense under POCSO Act. So it is very clear.
Thank you, sir. Thank you so much.
Yes.
Thank you, sir. Now we have Dr. Rekha Gupta, ma'am. She has not been able to join because of some emergency in her house. So I would request anyone present here, please take this question.
Yes, from Kanpur, anybody can take.
Sir, let anyone take.
Oh, yes, anybody can take.
So,
Can
sir,
I
I'll
take
take
it? Can I take it?
Oh, yeah, oh yes.
A 17-year-old girl visits a private hospital with history of sexual assault. The doctor asks her to go to government hospital as it is a medical legal case and has to be examined by a government doctor. Is it mandatory that a victim of sexual assault has to be examined at government hospitals? Is it necessary for a female doctor only to examine sexual violence victims? Sir.
So it is not at all mandatory that victim of sexual assault is to be examined at government hospital only. So even in private sector, in private clinic or private hospital, whenever any victim of sexual offense or rape comes to you or brought to you, you are under obligation to examine and to treat and to form opinion. So it is very clear. Is it necessary?
But sir, most of the time the private doctors, they refer the case to the government doctor, as I was in government job for last 35 years, 37 years. So most of the time, but I think it is a wrong thing.
Even it is wrong thing. Even if they refer, then also they are.
Then also they have to inform the
under
police.
obligation
Yes,
to
sir.
inform police. Because once any responsible citizen of India, because in that very section of 19 it is prescribed like this. Any responsible citizen of India comes to know that it is a case of rape victim or sexual offense under POCSO Act, he or she is under obligation to inform police or CWC. So it is very clear whether she attends that very patient or not. But once he or she comes to know that it is a case of POCSO, he has to inform police. And it is
Sir,
not,
one question more. Suppose if we inform the police, can this be told to the patient or relative also, or we have just
it is not compulsory not to be told to the patient or patient's family. Willingness of patient or patient party is not required to inform police, because to inform police is very much mandatory under POCSO Act. And as far as the last part is concerned, whether it is necessary for female doctor to examine. So if female doctor is available, then it is always preferable to examine patient if a victim is a girl. But if female doctor is not present, and if, say for example, if she is bleeding, then can one wait to female doctor to come, or can that very patient is to be referred to any other hospital where female doctor is available? No. In this situation, even if male doctor available or is on duty, he can examine that very victim and he can treat that very patient accordingly. Of course, he will have to inform police, he will have to form opinion, he will have to examine, treat and collect evidences. So it is not at all mandatory that only female doctor can deal with the situation.
Yes, sir.
Yes.
Thank you, sir.
Yes.
So next we have Dr. Vani Puri, sir. So she is the president of IMA Ghaziabad. She conducts a lot of social awareness programs on adolescent sexuality. She has an interest in spirituality. And she's a tarot reader. She's the first one in our series to be a tarot reader. So singing, dancing, debates are other interests. And she anchors a show on community radio station about health. these are pictures of her activities that she keeps doing.
Thank
So-
you, ma'am.
Rani, congratulations.
Thank you, sir, and pranam to you, sir,
Yes,
and
ma'am.
my best wishes for your
Yes,
future
thank you.
endeavors.
Thank you. Thank you.
And we are with you, sir.
Hmm.
And thank you, Asha ma'am, for including me in this panel. Thank you, sir, also. So there is a scenario, sir, which I want to ask, and I think as the panel is going to its culmination, all the questions are answered themselves only. So a 17-year-old girl, she is in a relationship with a boyfriend, and she skipped her menses. Now she is very anxious that is she pregnant, and she visited a doctor. And she discloses that there were several episodes of intercourse between her and her boyfriend, and she's worried about her conservative parents also. Now, how they would react after listening to this, and whether she should continue with her studies like that. So, first questions are obviously all has been answered.
Yes,
that we
whether
should
to inform
inform police.
police, always yes.
Yes, sir. So the second question goes, sir, that whether to inform the girl's parents against her wishes.
So here again, she is 17 years. So she is more than 12 years. So
Yeah.
whenever victim is more than 12 years, she can take decision for examination and whether her parents are to be informed or not. If she is not willing to inform her parents, then we cannot force and we cannot inform and we should not inform.
Correct, sir. Correct. So the other question is whether to counsel the girl about the safe sexual practices or about the pregnancy and pregnancy care.
So as far as pregnancy and pregnancy care is concerned, if she is willing to continue pregnancy,
Yeah.
then naturally we have to go for antenatal checkup and we have to advise her accordingly all the investigation required and all the probable outcome of pregnancy, complication of pregnancy. We have to explain everything as we counsel any of our other patient. If she is not willing to continue this very pregnancy, then we can terminate pregnancy with consent of guardian.
Then.
And at the same time, we can counsel her about safe sex. But again, just I mentioned in prior discussion also,
Yes.
again it will become a case of abatement. Because when you are explaining everything to or counseling her to go for safe sex, so she will continue her practice of sexual activity. So it is very tricky situation, but we have to explain about her sexual health, but we cannot prescribe any contraceptive measures.
Patel sir, just I want to ask one
Yes.
question that how to document because we cannot disclose their names.
No, who said? Whenever we inform police, naturally we have to go with name, but it should be in a seal cover. We will send our report in seal cover to the police station. So police is investigating officer and under authority of law. So this information we can share with person who is under authority of law. So it is not disclosing or it is breach of confidentiality. But
Okay.
we cannot give all this information to third party. Say for example, any person from press, any person from press come to you that we have come to know that some victim of rape, victim of sexual assault had been to you or brought to you. Can you give some information? We cannot. We can give information, of course, but
There is one more
personal identity of patient should not be revealed.
Thank you, sir.
Thank you, sir.
Yes.
Now, this is Dr. Vandana Jain. She's a senior consultant at Ghaziabad, and you can see her garden and her dancing pose. So, over to you, Dr. Vandana, ma'am.
Yes, Vandana madam, welcome.
Thank you, sir, and thank you, Asha, ma'am.
Thank you.
And I thank for this wonderful opportunity. I got no many loopholes of POCSO after joining this webinar, and it's very interesting also. My question is, a 17-year-old girl had eloped with her boyfriend and became pregnant with 16 weeks of gestation and requested for MTP. She is not willing to reveal her boyfriend name and requesting not to inform to the police. Her father is refusing to give consent for MTP. What should doctor do?
So just I mentioned prior also in few of the cases, again here she is 17 years. So she is more than 12 years. So she can take decision for examination as well as if she is not willing to reveal name of her boyfriend, we cannot force. So it is very clear. And as far as termination of pregnancy is concerned, consent of guardian is very much required because she is minor, she cannot give consent for termination. When her father is refusing to give consent, her mother can also give consent. Any of her relative can also give consent. Head of the unit, head of the department, head of the institution can also give consent as a guardian. But in this situation, once father has refused, then mother will not usually give consent because there will be some big trouble in family. So in this type of situation, we can inform CWC because any person from CWC can give consent for termination of pregnancy. We can terminate pregnancy if our center is registered, we are qualified, and we will preserve product of conception. And if patient is willing, then we can send that very material to police for further investigation.
So, but this girl says she doesn't want to implicate boyfriend with DNA analysis.
Yes,
What doctor should do?
And then there again, there are two situations. If she is not willing, again, here she is 17 years, more than 12 years, so she can take decision. So if she is not willing to send product of conception, then we cannot force her. But at the same time, once we inform police, then it becomes a job of police. We are out of problem in this situation. Then it is a job of police to convince her what is importance of this product of conception to be sent for further investigation. And if she is not willing, then that is up to police and them. We are out of problem once we inform police.
So my one extra question.
Yes, yes.
As you said, if a sexual assault victim come to our private clinic, then we have bound to examine that patient.
Yes.
But sir, as per protocol, there is a proper kit for that rape victim to be. But we don't keep that kit, sir. Actually, that's the most important reason patients are referred. We are not carrying that MLC registers. We are not having those kits. So then we are also in trouble if we examine them, and it will even it will contaminate the examination if we do something else. So what will be the solution for a private practitioner?
In this situation, you can inform police. If she is not in an emergency, it is very clear. If she is profusely bleeding or any other problem, then we have to examine and we have to treat accordingly, irrespective of anything. But if she is not in an emergency, you can inform police that this patient was brought to me and it seems to be a case of sexual assault, but I do not have examination kit which is required under POCSO Act. So if you inform police, it shows your consent to comply with the provision of law. And police will take that very patient to government hospital or any other hospital where all these kits are available. But if you
ignore, as you said, sorry for the interruption. As you said, inform the police always. So when we are sitting in a OPD and we are having a lined up patient, so how to inform the police? Should we call them or we send somebody to the police station?
If you can, somebody in a writing, just I mentioned prior also, with acknowledgement you can inform. You can inform on telephone, and again it should be recorded one because you will have to prove in court of law that you had informed police well in time. So these are very much required. And once you inform police that this is the situation and we do not have any kit for examination, then that is up to police to manage that very case accordingly. But if she is bleeding profusely or any other emergency, then you will to examine and you have to deal situation accordingly.
Thank you, sir.
Yes.
Thank you, sir. So we are at the end of the official questions.
But
now, if anybody wants to ask any question,
they can ask. But first, you see chat box. If any query, any question raised by any delegates.
In chat box, there is just a lot of praise and nothing else.
Okay, fine.
So,
now
there are
it
any
is
questions,
open.
you're welcome.
But
Otherwise,
Dr.
before
Patel.
everybody goes away, we make our appeals and then
Yes.
we go with the
Yes.
question.
So, before we go for further question, it is my humble appeal to endorse my candidature for post of President Foxy election year 2024. Considering my seniority, sincerity, dedicated work since years together, and readily and easily availability for any Foxian friends in any given situation, as far as any odd medical legal situations are concerned, I am always there to your assistance. So if you consider that I can lead this organization in better position, then it
Yes,
is
sir.
a humble request to
Yes,
endorse
sir.
my candidature and to vote, support, and to say our other friends to vote and support me. Thank you very much.
Thank you, sir.
This is appeal on part of Dr. Asha Jain. She is going to go for post of chairperson, Food, Drug and Medico-Surgical Equipment Committee, Foxy. So in this, society will vote. But for that, in month of May, you will have to go for nomination. So society will nominate my candidature for post of President Foxy and candidature of Asha Jain for post of chairperson, Food, Drug and Medico Surgical Equipment Committee. And in month of August, 1st to 10, you will have to vote for me. And in second half, from 15 to 25 or so, for Dr. Asha Jain.
Yes, sir.
Thank you. Requesting you, please vote.
Thank you, sir.
Yeah,
Sir,
thank you.
can I ask one question,
Oh
Dr.
yes, oh yes, welcome, madam.
Thank you.
Dr.
Thank you,
Patel,
sir.
I just
Thank you,
want
sir.
to
Thank you, sir,
ask
for
you-
making us a part.
Bye.
Thank you,
I
sir.
just want to ask you, sir.
Yes,
Suppose I have seen any patient of this Poxo Act girl, and I have informed to the police also. Suppose if anyone from the family or from media, from press comes to ask about any query about that girl, should we give
No,
the answer? No.
Without permission of patient, you cannot reveal any information related to patient, not for POXO Act. Even in major patient also, in other cases also. Without permission of patient, you cannot reveal any information related to treatment given or examination or any finding to anybody. Unless person who is asking is under authority of law. So any relative, even parents or even press media person, you cannot. And you can refuse very well. No issue.
Thank you, sir. Thank you.
So is there any procedure for the online information for the police?
Yes,
I just mentioned you can inform by mail.
No, sir.
No, not by mail, online.
Ma'am, if you go to your police
Because
website,
usually the police
there is
doesn't
a way. Many cities have made FIRs online.
FIRs online, yes.
FIRs online, even information can be given online. It is there. The portal
Yes,
is there.
I wanted to inform this because we can inform on the online also.
Dr. Asha, best is to dial on 100 number.
Let it be clear.
Ma'am, but you know, you will not have any proof of it.
We are not complainant. Let it be clear. We are not complainant. We are only informer. So we have to simply inform police. It is not FIR.
It is not
FIR.
FIR.
It will be lodged on part of police only. We are simply informing that patient with this name, aged this and this, residing at, had been to me or brought to me, and on my examination, she was found pregnant by 6 weeks, and it becomes a case of POXO. That's all. You have to inform simply.
Yes.
Whether
Can we
police-
email also?
You can send it by email, by registered post, by recording on your mobile also.
Okay. 100 पे तुरंत उठाते हैं डॉक्टर आशा. They just
So,
pick up the phone, the
100
girls are
is
sitting there,
good
and he
option.
just can record it also.
But Kiran madam, I mentioned prior also, whenever you call on 100, you identify person whom you are talking.
Yes.
So he should be responsible person. So you ask name, buccal number, time and date you have to mention, and then you have to inform.
So can we share the national authorities? Can we share the addresses or online numbers where we can contact? Usually
आपका शहर स्पेसिफिक होता है मैम, शहर स्पेसिफिक
Okay.
Sir, but we have to give the phone number and address of the patient on the information na, that
Yes,
this
we have
patient,
to.
resident
Yeah,
of this
that you have
place,
to do.
mobile number this.
Usually police,
When we are informing police, then we have to give all the details of patient, name, her age, and her address, and our finding. We have to inform.
Even if that address is false, we cannot confirm the address. Whatever she is giving, we have to write.
Always it is advisable in this type of situation, ask for copy of Aadhaar card or school living
Yes.
also.
Some government certificate.
To
Some
confirm
government
age,
address proof.
to confirm age and to confirm her address.
Okay.
And sir, उसमें पेशेंट का कंसेंट लेना जरूरी नहीं है ना कि हम पुलिस को बता रहे हैं?
1 minute.
नहीं, consent जरूरी नहीं.
One after another. So, but word of caution, many a times Aadhaar card may be fake. So you confirm that Aadhaar card is true, and whenever you ask for copy of Aadhaar card, that copy should be attested by that very patient and person who has brought that very patient. It is very important, because if at all it is fake, then burden of proof will be on her shoulder to prove that whether it was true or whether it was fake, and you are out of problem. Otherwise, there could be allegation on part of prosecution that it was conspiracy between that very patient and relative and doctor, that she was minor, and then but Aadhaar card was fake, showing that she is major. So we should be very careful whenever we are dealing with this type of vulnerable situation.
Sir, apart from this, otherwise also, if we are going to admit any patient in the hospital.
Yes, for any patient. But for POXO, we should be little vigilant one, because it becomes a, whenever it is a case of POXO, it becomes a serious entity if we fail to inform.
So otherwise also we should keep the Aadhaar card of the patient and
Yes.
somebody from the relative while admitting in the hospital. Because there may be any mishappening with the patient while we are admitting any patient during cesarean or whatever. Apart from this possible.
So Dr. Gulati sir is still there. I would like to some comments from Gulati sir.
So it has been, thank you very much, Dr. Patel. It's a wonderful discussion, and I'm getting a lot of knowledge, because it's been simply wonderful, this discussion on POXO rather. And very, very informative. I think I've learned a lot from the discussion, and congratulations to you, sir, for
Thank you, sir.
I had some questions on urinary incontinence, but now the session is over now. But this particular section on POXO has been really wonderful, sir. Thank you very much.
Gulati sir, Kiran madam is still there, and I don't think she'll mind answering your questions. She's there. Kiran ma'am?
Kiran Pandey?
Mobile unmute ho jaiye, please.
Okay, sorry, I'll just go.
No, sir. Gulati sir, you may ask, and Kiran ma'am unmute ho jaiye.
Yes. Yes,
Kiran.
Dr. Asha.
Yes.
Dr. Gulati wants to ask you some questions.
Ma'am, I'm Dr. Gulati from.
Yes, I know. I've been.
Oh, God,
Yes.
thank you.
Nice to meet you, Doctor.
Yeah, nice meeting you. Ma'am, I wanted to know specifically about stress incontinence, the non-surgical methods. There's a lot of talk and literature also on the use of laser beam for correcting stress incontinence. I think there's a literature on plasma use for stress incontinence, electrical stimulation. I think you did mention electrical stimulation. And what do you have to say about, especially because the main workhorse is laser? There are urethral probes also now and vaginal probes also. What do you want your comments on these? Well, they have not appeared in the textbooks of PP and
Yes,
the normal
Doctor,
textbook had been used.
basically, Doctor, laser, I have also personally not used, but I've read about it. The basic idea of the laser is when the probe goes inside, and it transmits the waves. What is the reason is they stimulate. The electrical stimulation is done by the piezoelectric crystals when they go there. And that stimulation, it is the science behind laser is that stimulates the collagen formation. So the point, the paraurethral places area and the anterior vaginal wall, where do you want to the collagen specifically, although it is the laser is rotated 360 degree. So of
Yes.
course it will go to other places also, because pelvic tightening, support of levator and eye, which is decreased, that will also help. So, but specific points as those paraurethral areas. So the idea basically the waves, the electrical stimulation waves which we go, they stimulate the collagen formation. Now, they definitely claim, the machinery people, they do claim the success rates in different ways. Some amount of success is definitely there. You have to do at least 3 monthly or 3-4 sittings. For how long this is not a permanent solution.
I
So
agree.
how long it will remain? You have to do it again also, the repeated things. Now the things is one is it is costly. Another is it's the limited studies. Not many studies are there, but limited studies. What are they say? They state these all methods, this bulking agents or the laser therapy or electrical stimulation, they are all secondary to the second level options. If the person doesn't want surgical option, then it can be do. Even some there's a little bit because Asha said time is going, so I stopped there. The artificial urinary sphincter, that is also being tried, but again, even that is also, it has a limited experience. There are some persons who are coming out with the regenerative medicines also, like stem cell injections. So trial and treatment is going on in various forms. To be honest, how much they are successful, everyone claims their own, so we don't know exactly unless and until we do it yourself.
I think I agree with you there.
Yeah.
Just asking whether you
Surgical
have
part
any
we do know that gives result. ऐसा तो नहीं है, वो result पूरा आता है. mesh erosion को अगर आप थोड़ा संभाल ले, तो that is good. And these days the recommendation I told you, NICE का, they are of a autologous link, so reaction कम होगा.
Okay, thank you very much, ma'am.
एक क्वेश्चन मेरा डॉक्टर किरण पांडे, एक ये बात बताइए किरण जी, इज देयर एनी रोल ऑफ एस्ट्रोजन, लोकल एस्ट्रोजन एप्लीकेशन?
हाँ, मैंने आपको एक वो स्लाइड ड्रग्स वाली दिखी थी, वहां पे HRT का भी थोड़ा रोल करते हैं. लोकल एस्ट्रोजन से SUI फर्क हो गया. अगर आपका दिस इज हैपनिंग बिकॉज ऑफ द लाइक रिकरेंट UTI वगैरह में देयर इज अ डेफिनेट रोल, जहाँ पे वो सेनाइल वेजिनाइटिस और बिकॉज जो एस्ट्रोजन रिसेप्टर्स वेजाइना में है वही यूरेथ्रा में है.
बेसिकली इट इज इन वेजाइना,
बल्बोवेजाइनल एरिया, दो सेम है. तो लोकल एस्ट्रोजन से कुछ तो हेल्प मिलेगी, लेकिन ये कि डिपेंडिंग, और अब जैसे माइल्ड SUI है तो आप सारे नॉन सर्जरी प्रैक्टिकल बात कर रही हूँ, मतलब नाउ आई एम कि थ्योरेटिकल वाली पे नहीं, मतलब जिससे कि कीगल्स एक्सरसाइज, लोकल एस्ट्रोजन, ब्लैडर हैबिट ट्रेनिंग, ब्लैडर ड्रिल, all they can together make the patient at least comfortable to this extent कि वो अपनी social life, because वो सब चीजें हमने discuss नहीं करी. We all know कि SUI की वजह से फिर वो social outing बंद हो जाती हैं, they become inside for depression and all that psychological problems. तो लेकिन अगर moderate to severe SUI है, then these things will not work. They have to be there for supportive, but not, then you have to take a proper decision.
Have you any experience with the autologous rectus ये tape वाला?
नहीं, मैंने तो अभी नहीं, जब हम रेजिडेंट थे तो हमारे टीचर्स करते थे ऐसा। डेफिनेटली वो वर्क करता है उसमें, दैट इज नॉट। और ऑटोलॉगस में फायदा ये होता है कि वो देयर आर नो एंटीबॉडी रिएक्शन। ओनली थिंग कि ये थोड़ा कंबसन होगा, आपको 2 इंसिजन पैराकोलिक एरिया में पैरा इंसिजन लगाना पड़ेगा साइड में, एंड वहां से आपको 2 रेक्टस डिसेक्ट करके लानी है, दोनों तरफ की शीत पूरी नीचे करना है। थोड़ा सा लॉन्दी प्रोसीजर है, एंड 3 स्टिच एरियाज हैं जहाँ पे आपके बड़े एरियाज हैं जहाँ पे स्टिच थोड़ा जा रहा है। सो लेकिन अदरवाइज डेफिनेटली इफ समवन इज मोर कंफर्टेबल कैन डू इट। एंड दीस डेज
अब तो टेप भी बड़े अच्छे आ रहे हैं
इज
जिसमें
ऑफ ऑटोलॉगस।
रिएक्शन वगैरह कम होता है, अब तो टेप अच्छे आ रहे हैं।
नहीं, लेकिन अगर हम रिकमेंडेशन करें तो ऑटोलॉगस की है, लेकिन हाँ टीओटी और रिट्रोप्यूबिक टेप्स हैं, दे आर स्टिल गुड इफ डन प्रॉपर्ली। रिट्रोप्यूबिक टेप में केवल आपको सिस्टोस्कोपी इज मस्ट कि वो ब्लैडर में ना हो जाए, और लेटरल भी देखना है कि आइलिक वेसल्स एंड फेमोरल वेसल्स को इंजर ना करे।
ठीक, नाइस
मैम। डज डुलोक्सिन हेल्प इन दिस SUI?
हाँ,
डुलोक्सिन इज द ओनली वन जिसका रोल है। डुलोक्सिन का थोड़ा रोल है, बट डुलोक्सिटिन का आई हैव रेड वंस कि थोड़ा ज्यादा इफ यू गिव इट फॉर लॉन्गर टाइम सुसाइडल टेंडेंसीज आती है, सो दैट
डेरी लॉन्ग आता है, सन फार्मा का डेरी लॉन्ग आता है यार।
हाँ नहीं, बट इनमें लॉन्ग टर्म में थोड़ी सुसाइडल टेंडेंसीज आती है, दैट यू हैव टू टेक केयर। बट डुलोक्सिटिन इज द ओनली वन which is gives some effect, not solifenacin and Derilong में तो मैडम किरण जी वो है।
Sir, Dr. Ritu has joined
Solifenacin,
in now.
Derafenacin.
If she wants
हाँ.
to ask something, and then actually we've been 2 hours and 37 minutes.
ठीक है,
We need to
we'll
end
discuss
the
later.
session.
हाँ, आशा यू सेड इट, मैंने कहा इसलिए मैंने वहीं पे रोक दिया था।
एक बार और करवा दीजिएगा, SUI was good. डॉक्टर आशा, मेरा एक सजेशन है डॉक्टर पटेल, है ना, बिकॉज आई थिंक मोस्ट ऑफ द गायनेकोलॉजिस्ट OBGYN love and respect you like anything. मॉडरेटर, ये जितने मॉडरेटर, मेरा एक छोटा सा रिक्वेस्ट है, एक दिल का दर्द भी है। व्हेन देयर आर 4 सोसाइटीज आर देयर, इतने कम लोग पार्टिसिपेंट हैं, तो आई थिंक दैट इज द वेस्टेज एंड एनर्जी ऑफ द डॉक्टर पटेल एंड द मॉडरेटर्स आल्सो। अगर 4 सोसाइटी है तो कम से कम 30 लोग भी जुड़े, तो it should be should be round about 100. So it will be more beneficial.
111 है किरण जी, 111 है, I am seeing participants.
111 है? नहीं,
हाँ 111 है।
अच्छा तब ठीक है। इसमें
किरण
मुझे
मैडम,
11 दिखाई पड़ा तो मुझे
sorry
थोड़ा
to
सा
interrupt
डर
you,
हुआ, मैंने कहा इतनी
but
मेहनत
I think we are now on time. It will automatically end it. The Zoom meeting will automatically end it. We are
ठीक
on
है
time.
सर, तो ठीक है, मुझे तो
If you conclude it, then it is well
Thank
and
you,
good.
Dr. Patel. Thank you.
Yes, ma'am.
Thank you, Asha. All the best.
डॉक्टर पटेल, विश यू ऑल द बेस्ट।
Thank you, madam.
Thank you, sir.
Thank you.
All the
Thank you,
best.
thank you.
Best
आपने
wishes.
इतना हम लोगों को मेडिको लीगल पढ़ा दिया, और
Best
प्रचार
wishes.
पढ़ाते ही रहे।
Yes, sir. Thank you, sir.
Thank you.
काम
Dr.
तो
Asha,
सब
All the
good
best.
night. Best
कब
wishes.
कौन कहाँ
पढ़ा
लटक
दिया।
जाएगा कुछ नहीं पता
नहीं
लगता,
नहीं,
लटकेगा कब कौन कहाँ
किरण
क्या
मैडम,
होगा।
पढ़ा दिया नहीं। our goal is to sensitize our Foxian friends as far as POXO Act is concerned, and how we should be vigilant in our day-to-day practice, not to end up into any kind of problem. And
Yes,
if
sir.
at all we may end up into this type of problem, then how to get rid of that very problem was the motto of this discussion.
Very
We are
important,
always
very
there.
important.
We are always there for assistance to any of our Foxian friends in any given odd situation.
All
Thank
the
you,
best
thank you
to
very
you,
much.
Dr. Asha.
And thank you, Corona also, and Tirth in particular, because we are disturbing Tirth for so many times as far as flyer is concerned. Tirth do this, do that, and he's so calm to obey all the instruction. Thank you, Tirth.
Thank you, sir. You're most welcome. So now I am ending this session, right?
Oh yes, we
Thank
can
you.
confirm.
Yeah.
Thank you.
Okay,
Good
ma'am.
night.
Thank
Thank you
you.
so much.
Thank you, sir.
Mr.
Thank you,
Corona,
ma'am.
thank
Thank you,
you so much.
everyone.
And Tirth, you can share recording, huh?
Yes, I have already shared live
Yeah.
YouTube link in
Okay.
a group.
Last program and today's program, you send me a link, so I will put in the group.
Okay, no problem.